Okay, let's get started today. We'll throw out the latest numbers from the hospital. System-wide in the Baptist system, we've tested 511,551 patients with a total positivity percentage of 17.1%. If you look at current hospitalization numbers, looking at Baptist Memphis, the numbers have ticked down to as low as 12, back today to a little higher at 18. We have 12 people in non-ICU acute care beds with COVID and 6 in the ICU with COVID. And 3 of those 6 people are on ventilators in the ICU. 2 of the 18 people are fully vaccinated in the hospital, and we had 1 admission overnight, and that person was not fully vaccinated. Looking at Baptist DeSoto, there are 19 people on acute care non-ICU beds with COVID and 5 in the ICU for a total of 24, also a little bit of an uptick. And 2 of those 5 people in the ICU are on ventilators. They have 1 patient of those 24 in the hospital who are fully vaccinated, and of the 2 admissions they had overnight, there were none who was fully vaccinated either. So those are the numbers. I will tell you, I can't remember whether I said this last week, but it certainly is true this week. We're certainly grateful for the numbers being a lot better now. My group has been a little concerned in that we've had a lot more phone calls in the last week or so, extending back into the week before, about new cases. There have been a few events in town that have spawned 15 and 20 cases from them, and just had a lot more phone calls. That makes me a little nervous because that always seemed to be what happened prior to seeing numbers actually tick up, both in our hospital and really around town. Whether that is true or not, I certainly hope not. But obviously, it makes us be a little bit careful about what we're looking at. So happy to answer any questions if there are any.
Hey, Dr. Threlkeld, it's Corinne. How are you today?
I'm good, Corinne. How are you?
Doing all right. So obviously you mentioned you are getting more of those calls. There has been a slight uptick in the hospital numbers, but we're, I think, still in a decidedly better place than maybe 2 months ago. But it's hard to ignore news coming out of, Minnesota and Colorado and places like that. How concerned should we be about the surges taking place in other states?
Yeah, and just to even go one further, the surges that you see that are maybe just as dramatic or more so in Europe, and we have, we would be silly not to recall that that's what happened before our surges before, in previous episodes. So paying attention to that is pretty important. And yeah, I think part of it is that we have kind of had our major Delta run here, and it's burned out a bit in our local community, and a lot of those people haven't. But I think we also have to realize that some of the people in those other states that are feeling a lot more of the heat now are better vaccinated than we are. So I think it kind of cancels out in some ways. But the problem that we have to think about is that they are still, despite being 60% vaccinated or higher, still that's a very large number of people that remain unvaccinated. And when you look at the numbers that they're experiencing, when you look at the numbers that they're experiencing in Europe, we still see that the majority of people who are getting really sick from this and driving these surges are people who are unvaccinated. Clearly, antibodies are waning. It's why we have the whole booster question, which is an entirely different topic and more controversial, I think. But if you look at I think some data came out of Vermont, which is a pretty highly vaccinated state, but they've been having a surge. It's mostly been driven by people in their 20s who are less vaccinated than the older age group. But again, a majority of people are unvaccinated, and the younger kids who have not yet been vaccinated. So that's been a large majority of the cases that are going around. But once again, it's the unvaccinated as well as the elderly and relatively immunosuppressed people who probably have a bigger phenomenon of waning antibodies and lower protection, even despite vaccination. So those people have paid a bit of the price too. So they can get recurring infections and get sick more easily than younger, healthier people can despite vaccination. So I think the lesson is not that we're about to repeat the surge like the upper Midwest is seeing right now immediately. But I think it does point out to us that there are many factors involved in this infection, many of which we can't control. I mean, the weather, it's tempting to imagine that the people in these upper Midwest zones are inside more. They've had parties through Halloween and the early part of winter that drive people indoors into smaller spaces, and that's very helpful to the virus, not to mention the drier climate in the winter months, and all those things have shown before that they can increase viral replication. And so that certainly plays a factor. Will we see that more when we get into December and January, where the weather might get colder here too? Again, I think we would be less than smart not to think about that and plan for it, just as restrictions are being relaxed here, and that's not unreasonable because our numbers really are a lot better. But we probably need to still have a mind about avoiding events that are just going to give the virus a very easy time of it. And this is not even to mention when you look at influenza, there's the first sort of danger sign of influenza this winter. The University of Michigan has had a very large outbreak, more than 500 cases since earlier in October. They have, I think, the last check, a 37% positive rate of all the flu tests that they're doing. It was so bad at the University of Michigan that they sent a response team from the CDC to investigate that. It appears to be an H3N2 influenza virus. We've all been hoping that influenza would not take off and be a problem this year, but it's been a year and a half since we've seen influenza with any regularity now, and so there are people without lingering immunity from the year or two before, which could make it more severe. So it is certainly a real concern, and what they've seen on that campus has been pretty impressive so far. We hope that doesn't spread, but obviously the CDC guys are on the scene to assist with trying to keep it that way and keeping it from spreading out. But I think the main lesson with this is common sense. I mean, we've really taken a beating in recent months, and we're better off right now. But we know that the thing can come back. It's happened now on multiple occasions, and you're only partly protected from recurring episodes with the vaccination. But if you look at hospitalizations and deaths, it's still dramatically protective to have been fully vaccinated. And those are the things that obviously we're trying to avoid the most. But also, again, it always disappoints me to hear the arguments against being bothered by this or being bothered to make any behavior modifications or to get vaccinated. I think we can't disregard the health of those people around us who can't get the protection. Either they're elderly, they're immunocompromised, and the like. So we have to try to protect those people too. And I think we have to watch out in the coming months that this thing doesn't come back. And we don't need to just resist ways to prevent that from happening. Any other questions? I have a number from the feed that I would like to sort of mention, and please interrupt me if anybody has any other questions. There just was a very spirited discussion on the live feed from last week, and very honestly, I felt tempted to deal with some of the I think information gaps that were presented last week, and I won't use many names in these, but I felt like it'd be helpful to get some answers to some commonly I think voiced complaints about over worrying about the disease or the vaccine and so forth. So let me just wade in with a few of them. One viewer said, can he explain the almost 20,000 deaths listed on VAERS? That is, of course, the vaccine early adverse effect reporting system that you can report any problem related to the vaccine. I have used that system early on when we had a person who had the MIS syndrome, just had the vaccine as well. So we really got the CDC and others to come in and evaluate that case. So it's a tremendous system. It really allows us to see early situations. But I can easily explain the fact that there are 20,000 deaths listed on VAERS, and I do not think there are 20,000 deaths from the vaccine. And the reason very simply is that these are raw reported incidences of people who've had bad health outcomes, and they may have had the vaccine in the recent past. And once they have been investigated, and the ones that have been, the number is extremely low in terms of any sort of vaccine causing that. The reason that that number is high, it's the same as any other sort of public reporting system. It's why when a missing person is called in, people don't routinely send out the hostage rescue team to work on this, because the vast majority of those turn out to be misunderstandings. And though there can be terrible outcomes in both, the reality is that the numbers that are reported in the gross sense or in the first sense are much, much higher than the actual incidence of problems related to the event. So I think that's the simple answer to the question, that these things have not been investigated. About 1,800 people, if I remember correctly, per day die in the United States. And that is with or without vaccinations. And so the key is, were any of those deaths or any kind of problems people had related to the vaccine? And when you really investigate them, you find out that that really has not been the case in the vast majority. Donna asked, are you seeing hives after a month as a reaction to the booster? I can tell you that I've seen the occasional hives as a reaction to this and any other vaccination, but I've not seen it really come on a month after the booster, or really any of the other vaccines for that matter. It's not, we typically see hives as an early, immediate even reaction immunologically to things. It's part of the more anaphylactoid kind of reactions that happen right away. But certainly they can happen later on. They could happen after the infection or the vaccine, but it's not something that I've seen with any regularity. One viewer mentioned, my neighbor got the jab and now her blood pressure drops when she stands, so it's the vaccine causing that. And I think this respectfully sort of avoids the reality that this is an anecdotal report of someone having a problem after the vaccine. And first of all, that's not at all proved that it's related to the vaccine, because that's why we do placebo-controlled trials, when we look at large numbers of people who got the vaccine and compare that to people who got a saltwater vaccine to see if they really have more of anything in the vaccine arm. Now, you can't pick up every rare event in those even large trials, and of course has been a concern throughout. But I would say that we certainly have not seen this in any large numbers, but even if we do see it occasionally, we have to remember one other factor, and that is that you can have immunologic reactions to vaccines. There's no question about it. We see all manner of them, but the vaccine is nothing more than a minuscule amount of viral protein that we put in you so the immune system can recognize it when it sees the real thing. The real thing is, in fact, thousands of fold higher amounts of the same stuff. So if you had this kind of small reaction, or even an important reaction to the vaccine, it would be dramatically more likely that you would have an immunologic reaction like that to the virus. And in fact, that's what we see. It is common for me to see people who have blood pressure abnormalities, where their blood pressure drops or ranges widely, along with pulse rate and other kind of cardiovascular side effects, with COVID-19. So it would not at all be surprising that you would see a much smaller number of those things with the vaccine, because it is, after all, a small version of that infection that alerts the immune system. So I think that's probably the explanation for why that happens. Diane says, it ticks me off that Biden said it's 100% safe. Really, tell people the truth and read the side effects out loud like they do with other drugs. And there are a couple other comments. And completely agree, Diane. I think that I didn't hear the president say that it was 100% safe, but if he did, obviously that's incorrect. And I'm not here to back up what any politician says about a vaccine. I mentioned last week, I think in some detail, but I think we have to be very careful to be ideological on both sides of this. We have to go with what the facts are. And above all, we need to be honest with what those facts are. There are people who are going to have significant reactions to the vaccine. There may be a few who die of it. Those are tragedies. We want to avoid those any way we can. But with over 760,000 people dying of the infection, we also have to face that reality too. So I think it's very important, in fact, to tell the truth about everything that happens about this vaccine. So I completely agree. If that was said, it's clearly inaccurate. Bonnie Cummins asked, how effective is the antibody infusion? I would mention that just related to the new medications that are going to be facing the FDA shortly, the new oral medications, which are going to, I think, be extraordinarily effective. The antibody infusion, which we gave the first of in the country a year ago yesterday, they have been very effective. 70 to 80% decrease in hospitalizations and deaths in people who were high risk for having those complications. So they're very, very effective, and they've been very safe. We have given, I think, in the neighborhood of 19,000+ doses of the monoclonal antibodies in our system at this hospital, and I think that has saved quite a few lives, very honestly, at doing that. So I think they're very helpful. The oral medication may be more helpful. If you look at the latest, there's molnupiravir from Merck that's already been approved in the UK and is being looked at on November 30th by the FDA advisory panel for approval for emergency use in the United States. That had a 50% decrease in hospitalizations and death. Effective enough that the trial was stopped by the independent data safety monitoring board assigned to that trial. So they said it was no longer ethical to continue a trial where people were dying in the placebo arm, but people got the medication, were surviving at a larger rate, and that rate was cut by 50%. The newer medicine that has been now has just applied for emergency use authorization from Pfizer appears maybe to be even stronger. In their trial, 89% reduction was seen in hospitalization and death rates in those people. That is an amazing statistic. It was most effective when given 3 days or less after the onset of symptoms. This is not a surprise. All antivirals that we know of historically are more effective when you give them early on. You want to give them before the virus has had a chance to make a lot of copies of itself and to do damage to us. So an extremely high effectiveness rate, and I think that could really change the game. Not to eliminate vaccinations, not to eliminate other things we do, but maybe to use in combination. They'll be cheaper. They'll obviously be easier to give. Monoclonal antibody requires an infusion or a subcutaneous infusion in a healthcare kind of setting. So it'll be much easier to do, not to mention the fact that both companies, Merck and Pfizer, have agreed to license this out at low cost to countries that have not been able to get enough vaccines and probably wouldn't be able to get full price medication. So it can stand to be a sea change in what happens in some of the poorer countries in the world to be able to take a low cost pill to cut hospitalization and death rates by up to close to 90%. Now, before we finish that, we only have the company's press release that they have on these medications. The FDA panel and the FDA in a larger sense will have all the specific data from those trials. There may be things that we need to look at, other safety issues, how many people were pregnant, how many people were in each different type of group who got those medications. So we don't have all the answers yet. I mean, I'm not necessarily ready, along with a lot of others, to jump completely on the bandwagon. But the UK governing body that corresponds to the FDA did look at those data and approved it for emergency use in the UK. So it'll be very interesting at the end of the month here to see what the FDA panel says about molnupiravir. I'm not sure whether they're going to have time that day to look at the Pfizer drug too. They might, but as far as I know, it's not necessarily going to be the case that they will be able to evaluate that the same day. It's called Paxlovid is going to be the new drug, and it is the Pfizer drug that had 89% effectiveness is called a protease inhibitor. And if that term sounds familiar, it's the same class of drug that we have used in HIV since the mid-90s, the first time it came out, and I used it, and also against hepatitis C. In fact, packaged in that drug is one protease inhibitor called ritonavir that will help to boost the level of the other protease inhibitor in the mix. And so we've used these drugs for many years. They've been pretty safe and very effective against HIV and hepatitis C. So it's very, very exciting, I think, the worldwide impact that those medicines will have. But again, the monoclonal antibody is very effective, to get back to Bonnie's question, but it's not convenient to give. And I think the medications may very well take over that market soon. Though again, it's important to think in all viral infections of combination therapies. We learned this with HIV. AZT came out and was great until it very quickly wasn't great. Resistance came up. And these protease inhibitors work at an entirely different area from the spike protein, where the monoclonal antibodies work, and some of the other things that we're using. So it'll be a great thing to add to our armamentarium. One other viewer said, I know a man and wife that have had 3 shots apiece. Both have come down with COVID this week. And once again, I think this is an important thing that's sort of a narrative that is pushed against folks, in that the fact that you've been vaccinated does not mean that you can't get infected. It just means that you're dramatically less likely to get ill, hospitalized, or to die of this infection. And it does, in fact, mean that you are significantly, many-fold times, lower likelihood of getting the infection at all. And that's the point that's missed. But some of these people may have been elderly. They may have been immunosuppressed. They don't have to be, but that would greatly increase the chance of that happening. What's important is, what is the percentage of decreased likelihood of that happening? And so the fact that it happened to 2 people, even in the same household, is not at all a surprise. What's important is, how many nationwide does it cut in that likelihood of happening? Here's one that said, what do you say to the virologists who say that vaccinating at the beginning of a pandemic makes everything worse? Well, Well, I am a virologist, and so I guess we're probably hanging out with different virologists. I go to all the Christmas parties and the meetings, and I don't know of any virologists that say that. I don't doubt that you can find them on the internet, but in all seriousness, virologists don't really say that in any numbers. The idea that vaccinating is a bad thing is something you're not likely to find many virologists say, since they've devoted their life to that sort of thing. And even if somebody did want to say it, it's not early in the pandemic anymore. So I think that would probably be something that it's the sort of thing that people say, and it even can sound good to some people, but that's not really the truth of the matter. And again, just trying to sort of answer some of these things that I think are common problems that people might have a hard time answering when they see them. They look good on the surface. Here's another: with a 99.7% survival rate and a quote vaccine unquote that does not prevent transmission of the illness, what is the point of getting the vaccine? I got the shots last spring and still got really, in all caps, sick with COVID. There's several things about this that I just want to address briefly. One is the idea that it doesn't prevent the transmission of the illness. This is simply not true for a couple of reasons. It's commonly thrown out there by people who are against the vaccine. They say it doesn't prevent transmission. It absolutely does, because you're several-fold less likely to get infection at all if you have had the vaccine. So last I checked, what you don't have, you cannot give to someone else. So studies have shown that you're 10 to 20 times more likely to transmit COVID to someone if you're in the presence of someone else than if you're vaccinated. So if you are around someone, you're 10 to 20 times safer if they have been vaccinated than if they are not. And even if you fail and get the infection despite the vaccine, which certainly people can, it's been shown that your viral load is lower, and though you can transmit it, you are still significantly less likely to give it to other people, even if you get it. So on its face, that is wrong by two different ways. And as for the point that someone who got the shots last spring and still got really sick afterwards, there are two things. Number one, antibodies do wane, and you are more likely to get the infection months after you got the vaccine. As for being really sick, though I'm very sorry that happened, I have a relative viewpoint of being really sick. I have lost more people in the ICU to COVID than I can count. So really sick is a relative thing to me. And somebody obviously who recovered from it is doing fine and able to write this. That sort of, by definition, that we look at in the hospital is not necessarily really sick. So what this vaccine does clearly, and you can show it by any number of good studies, cuts dramatically the people who get sick or die from this. And it does, in fact, and again, this is the point I really want to stress, it does prevent infections altogether by several fold. So the idea that it does not prevent the spread to somebody else is simply false. And I think that's been shown all manner of situations. One writer says, doctors have had their licenses revoked if they speak against the vaccine. So I admit that I haven't kept up with what happens to people who speak against the vaccine, because I haven't done a lot of that to worry about it. My understanding is that people have been reprimanded or even sanctioned for spreading misinformation. And it may surprise you to know, or at least the viewer here, that I agree. I have a great deal of concern over how we deal with people who say what we disagree with. I think if nothing else in this country, we have the right to be wrong. And though I would disagree that going around telling people the vaccine doesn't do any good and you shouldn't take it is incorrect in a very large sense and could be damaging, it makes me nervous, because who decides what's right and wrong in a medical situation? Further, it can change. I mean, medical facts can change, more studies can come out. So I share your concern with how you actually reprimand people. Now, if you can tell that someone is deliberately spreading misinformation that can harm to someone, well, okay. But I think how we do that indeed is a very difficult thing, and I'm glad that I'm not a person who has to make those kinds of decisions. Isaac Kike wrote, flu vaccines have had some complications, and they have. There's no question about that. They continue to. Flu still kills 30,000 people a year in this country on average, though essentially none last year and very, very few the year before. But as I've said, I think on a number of occasions, even the worst possible year for the flu vaccine, which is 1976 with the swine flu vaccine, people got a disproportionate number of cases of Guillain-Barré syndrome. 85, 90% of people recover fully from Guillain-Barré syndrome, though it can be a very difficult prospect. But even that year, I've said, I think several times before, if you went back in a time machine, you would still mathematically want to get the vaccine, because you had a higher chance of dying from influenza than you did of even getting one of those important side effects from the vaccine, almost all of which you recovered from. So no mathematician would tell you not to go back and take that vaccine. And just a couple of more. This was kind of one reader commenting to another that they were very correct. When we discussed this with our pediatrician, she had no choice but to agree there is zero long-term data. Zero. Without that, it must be deemed experimental, period. I almost don't know where to start here. It would suggest maybe that the pediatrician still thought that they should give a vaccine. But if we're going to say, is there long-term data for these vaccines? Of course, there is not. It hasn't been out long enough to have a lot of long-term data. As is true of most things that meet FDA approval, they've not been around for 10 and 20 years. That's kind of the point, because if the numbers really look good in short-term data, then how many people are you going to sacrifice to die for not approving it and giving it to people based on outstanding short-term data? Because people do die when they don't get the vaccine. This much is fairly easy to show. So let me tell you about the short-term data. The short-term data are that 760 plus thousand, more than 750,000 people have died in the short term in the United States alone, let alone people around the world. And yes, a few people may have died from the vaccine. I have, and my colleagues here in town have not seen a single admission to the hospital, however, from the vaccine. That is not to discount the people who've had serious side effects. Those are tragic in every situation. But to suggest that the short-term data don't dramatically favor the safety of the vaccine over facing the virus alone without one is very, very mathematically, it's just a very hard point to make. I think it's impossible to make. And further, one other point about long-term side effects that I think I've said in the remote past, long-term side effects of a vaccine is not a thing. It doesn't exist without short-term side effects. So almost, I mean, in every circumstance, vaccine side effects happen up front. Now, they may last a long time. And the rarest cases of Guillain-Barré syndrome that last a long time and don't recover, yeah, that's a long-term side effect. But it's a short-term side effect that just lasted a long time. That's very different. The idea that vaccines are going to pop up 3 years after they're given and cause people to turn green or to have some other side effect that would be important or even just a nuisance is not something that has ever been demonstrated before, ever, with any disease or vaccine. So I think the idea that the short-term dramatic protection of this vaccine could ever remotely be compared to something that's never happened historically before is more than just a mathematical stretch. I think it's just not something that you can reasonably assume. And then finally, more controversially, and I'm sorry I don't have this one in front of me, but the person posted it 3 times, and I'm sorry I didn't answer it right away because I don't get to see these things every day. The question involved, do I think it's okay and do I support people losing their jobs in general because they don't get the vaccination? And what I would say is, and I think the question really, if I remember correctly, spoke to, is it okay to require vaccination in nurses and healthcare facilities for COVID-19? And I have a very clear answer to that, and that is yes, I do support requiring vaccines. And listen, I have gone on and on this venue and others extolling the virtues of my nursing colleagues. I think they have had the most stress, the hardest time, and have performed the most admirably of any of us in healthcare through all this. So I would not say this is about nurses. I think this is about everybody in healthcare should be required to get the vaccine. And the reason is very simple, because we swore an oath to protect the people that we take care of. And it is clear, I mentioned, if you're around someone, there's a 10 to 20% chance, 10 to 20 fold, 10 to 20 times higher risk to you if somebody's unvaccinated compared to their being vaccinated. And if I'm taking care of heart transplant patients or bone marrow transplant patients or other people that are high risk in the hospital, I told a nurse that was asking me about this not too long ago, and they really didn't want to get the vaccine and was struggling with it. And I told her the following, and I stand by this. I said, listen, if you can go home tonight realizing that you have an opportunity to make it 2 to 5 to 10 to whatever it is, fold difference in protecting the patients around you that you take care of by getting the vaccine, and you don't do it, and that doesn't make you lose sleep at night, then maybe you should do something other than healthcare. And I stand by that, and I feel very strong about that. Speaking for myself, it's not speaking for any institution or anyone else. But I think that if you're going to be in healthcare, you have to protect the people around you. And when there's a vaccine that has that degree of protection, I think it is fine to mandate that, particularly after it has received full FDA approval, which it has. I certainly was much more hesitant about that when it had not received full FDA approval yet, and that's where people could theoretically call it an experimental vaccine in that sense. It's a bit of a stretch, but once it's received full FDA approval, calling something experimental seems to me to be more of a political ploy than it does an accurate scientific description. So sorry for that harangue, but I just wanted to deal with a few of these questions that people are facing. I get friends who come to me and say, what do I say to this sort of thing? I think most of these sorts of questions have good, clear answers that we can actually put real data to them. And I think all of these situations come down in favor of being vaccinated. I hope they will come down in favor of the oral medication, but we haven't seen enough data to do that. And I hope we will wait for proper data in these situations, but I hope we'll get through those data quickly and approve the oral medications if they do pan out, because things like that are the way that we advance this thing and get rid of the pandemic once and for all. Any other questions I can answer? Okay, thanks very much.